According to Beck Institute for Cognitive Behavioral Therapy, cognitive behavior therapy, also known as CBT, was developed in the 1960s by Dr. Aaron Beck. CBT is a solution-focused therapy. It focuses on the relationships between a person's thoughts, feelings, and behaviors. Using the example here, a person's thought is, "I hate work, I can't get up." This transfers to a physical response from the brain of feeling sluggish with no energy. The feelings that come along with that is sadness and frustration. The feelings and thoughts then transfer into the bigger picture, which is the person's behavior. In this case, staying in bed all day and avoiding people. The therapist and the client work together to develop more constructive ways of taking those negative thoughts and creating positive thoughts, which then in turn create positive feelings and behaviors. According to Cognitive Behavior Therapy Basics and Beyond by Judy Beck, some of the main ideas and principles of CBT are the following. It requires good client-therapist relationship, just like any other type of therapy, emphasizes collaboration and active participation. The client must be active and involved for CBT to be helpful. It's educative, teaches the client to be his or her own therapist. It uses the techniques to prevent relapse. Homework may be assigned for the client to practice the techniques learned on their own. Most importantly, the therapist does not tell the client what their goals should be or what they should tolerate. CBT therapist does not tell their clients what to do. It's teaching them how to do it. The National Alliance of Mental Illness defines mental illness as a condition that impacts a person's thinking, feeling, or mood and may affect his or her ability to relate to others and function on a daily basis. Some examples of mental illnesses that we know are attention deficit disorder or ADHD, anxiety disorders, autism, bipolar disorder, depression, and post-traumatic stress disorder. It's important to know that people with the same diagnosis have different experiences. As social workers, we may see multiple clients with the same illness, yet each case is different. Treatment will be individualized. Mental health condition is not the result of one event. Research states that it can be interlinking causes. For example, genetics, environment, and lifestyle can be factors into development of a mental health condition. There are 5 mental illnesses that are traced to a person's genetics. They include depression, bipolar, ADHD, schizophrenia, and autism. Psychiatric conditions are of the most heritable of all disorders. Findings by researchers at the Duke Institute for Genome Sciences and Policy have found that 30 minutes of question and answer about a family history of depression, anxiety, or substance abuse is enough to predict the patient's future or risk of the condition and the extent of severity. This chart here is the statistics in America for adults. 43.8 million adults experience mental illness in a given year, which is 1 in 5 adults in America. 1/2 of all chronic mental illness, such as bipolar, begins at age 14, the rest by age 24. Here are the broken down by each disorder. 2.4 million American adults live with schizophrenia. 6.1 million American adults live with bipolar disorder. 16 million American adults live with major depression. And 42 million American adults live with anxiety disorders. There are so many treatments out there for mental illness. However, not everyone receives treatment. Do you ever wonder how many? Well, 60% of adults with mental illness did not receive treatment in the last year, and 50% of youth aged 8 to 15 did not receive mental health services in the last year. In general, adults are more talked about with mental illness rather than children. However, seeing how mental illness is genetic, we are seeing more children diagnosed with mental illness such as autism, and it's important to look at those statistics also. This chart looks at children and adolescents living with mental illness. 1 in 5 children ages 13 to 18 have or will have a serious mental illness, which is 20% of all children. 11% live with mood disorder, 10% have behavior or conduct disorder, and 8% have anxiety disorder. Mental illness and children have a significant impact on their lives. The diagnosis, treatment, and severity all factor into the overall impact on the life. If there isn't a treatment plan or if mental illness isn't caught, there are severe implications. In this case, 90% of those who died by suicide had an underlying mental illness. In many cases, children rely on their parents and schools to look out for signs of mental illness. Children with mental illness can have a hard time explaining or expressing their feelings if something isn't right. In the state of New Jersey, 8.7 million residents live with a serious mental illness, and 93,000 children live with a serious mental health condition. With this amount of people just in our backyard living with mental illness, it's hard not to think that the people walking by us on the street are suffering. There are a number of resources for them in the state. Here in New Jersey, the Division of Mental Health and Addiction Services serve adults with serious mental illness. They serve 6,500 people who require intensive hospitalization and 270,000 people who are able to live independently and use resources in their community. They operate 4 psychiatric state hospitals such as Anchorage, Greystone Park, Trenton, and Anne Klein Forensic Center. For children, the Department of Children and Families Children's System of Cares serve children and adolescents with emotional and behavioral health challenges. As social workers, these resources will be an important part of our treatment of our clients. We will need to know the resources available, whether it be within their community or a state facility.
Good afternoon. My name is Danielle Johnson. You can call me Danielle. I'm working towards obtaining my LCSW attending Kane University's graduate program in social work. I've been an intern at ABC Behavioral Center for 4 months now, working with clients that have a diverse need for cognitive behavioral therapy. Do you prefer being called Lisa or Mrs. Smith?
You can call me Lisa. Thank you for asking.
I know that it took a lot of courage to come in and seek help, and I thank you for being on time. Can I get you a glass of water before we start today's session?
Thank you. I'd like a glass of water.
Here you go. Let's start by getting to know you a little bit better. Tell me about where you were born and where you grew up.
I was born in Passaic, New Jersey. That's where I grew up until moving to Essex County when I was about 12. And my parents raised me until they got divorced. And I have 3 sisters and 3 brothers.
Thank you for sharing your family history. Your family history will help me understand a little bit better. So you were born in Passaic, New Jersey, and you moved to Essex County around 12 years old, and you were raised by both biological parents, and you have 3 brothers and 3 sisters.
Yeah.
Is that right?
Yeah.
Okay. Tell me about school growing up and what school's like now if you're attending college.
School was fine when I was growing up. I didn't have any issues in school. And college now is torture, but I'm dealing with it. It's really hard.
Okay, so you're in college now and you're getting through it, and growing up, school was fine with no issues. Did I miss anything important?
No, not at all.
Okay, can you tell me about things in your life that you consider important?
Wow, things that are important. Family, my family is important. Good health is important. And having a great career that I enjoy is important.
Okay, I see that health, family, and career are very important to you. Can you tell me about your current worries or difficulties? What would you like to change or improve about your life?
That's tough. I guess I've been feeling down in the dumps for a good month now. I can't seem to snap out of it.
Lisa, I'm sorry to hear that you've been feeling down. Can you tell me more about your symptoms, such as sleeping patterns, eating habits, and interaction with friends, family, coworkers, and if your job has been interrupted by you feeling down?
Well, I haven't been able to get out of bed. I'm overeating. I don't feel like going out with anyone or even talking on the phone with anyone. I've been late to work a lot and making excuses to leave early. My boss is starting to get mad at me. I just don't enjoy the things in life that I used to.
I see. I do have to ask, are you thinking about hurting yourself, or do you have plans to hurt yourself? I want you to know that everything you say in our sessions will be kept confidential, but I would have to make a report if you were at risk of hurting yourself.
Well, sometimes I think about dying, but I would never do it. So, no, I don't have a plan.
Okay, your openness is really helpful, and I want you to know that we can definitely work together to get a better control over your feelings so you can live a normal life again. Do you want to hear more about how CBT works for depression?
Yes.
Okay, today's session has several goals. Let me know if these work for you. 1, get to know each other better. 2, discuss rules for the sessions. And 3, learn what depression is. And 4, to learn how your thoughts affect the way you feel.
Yes, I'm desperate to try anything except medication, so I think this would be good for me.
Great. Let's start with some housekeeping. I have 3 basic rules for our sessions. 1, arrive on time. 2, come every week. 3, do personal projects. Do these seem reasonable?
Yeah, I can do all 3.
Great. So the purpose of this session is to introduce you to therapy in which you are going to participate. The kinds of skills we provide are called cognitive behavioral therapy. Cognitive refers to our thoughts and behavioral refers to our actions. Depression has most to do with our feelings. By identifying thoughts and actions that affect our feelings, we can learn to gain more control over them and improve our mood in order to feel better. This treatment for depression consists of 12 sessions. We focus on what is going on in life right now, in the present. The therapy is focused on how to control depression in practical ways that can be used now and in the future. Have you ever been to therapy before to treat depression or something else? Was it like CBT, and if so, was it effective?
Yes, I've been to therapy before. I don't think it was CBT. I really don't feel it was effective.
Okay. We will divide the sessions into 3 parts. For the first 4 sessions, we will discuss how your thoughts affect your mood. The next 4 sessions will be about how your actions affect your mood. The last 4 sessions will be about how your relationships affect your mood. Overall, this type of treatment will teach you practical skills that you can use in your daily life. Do you have any questions so far?
I just don't know anything about my depression or what's causing it. How can I fix it if I don't know what's starting it?
Well, let's explore what the word depression means together. The word depression is used in many ways. Depression can mean a feeling that lasts a few minutes, a mood that lasts a few hours or a few days, and clinical depression lasts for at least 2 weeks, causes strong emotional suffering, and makes it difficult to carry out our daily activities. This treatment focuses on treating clinical depression. As you stated before, you're not interested in the things you once enjoyed. You're sleeping too much, overeating, and work is becoming interrupted. Can you describe how you've been feeling lately?
I guess I have been feeling tired all of the time. I feel worthless and guilty. I feel spacey. I can't concentrate.
I see. You haven't been I see. You've been overly tired and have been feeling guilty and worthless. What passes through your mind when you feel sad?
Well, I think about how I would be better off dead and that life sucks. I think I will never be able to be happy again and that I am meant to feel this way forever.
So your thoughts are that you'll never be happy again and that you might be better off dead. Is that right? Tell me what you do when you're depressed.
Exactly. When I'm depressed, I don't do anything. I just can't get out of bed, and I'm constantly thinking rapid thoughts that don't make much sense, and I order takeout for my meals. I don't even cook anymore like I used to.
So you like to cook and be active, but have been having a tough time doing so. Describe your relationships with people now that you're depressed.
Well, my relationships are pretty distant, I guess. My husband doesn't know how to help me. He's supportive the best he can be, but I can tell that he's starting to get irritated with my laziness. He doesn't understand that I'm depressed. I've stopped going out with my work friends because I just no longer have the energy to talk and have fun. My children are grown, so they're not aware of how I'm doing and haven't reached out to them lately to see how they're doing either.
Sounds like you've distanced yourself from your loved ones and have become quite isolated. I want to close our discussion by reviewing how we understand depression. Having certain types of thoughts can make you feel more or less depressed. And by thoughts, we mean things that we tell ourselves. Thoughts can have an effect on your body. Thoughts can have an effect on your actions. Thoughts can have an effect on your mood. What does this mean to you?
Well, it means that thoughts have an effect on my body, what I do and how I feel.
Okay. I want to give you an example of how a thought can have an effect on your body, actions, and mood. Okay, so picture yourself walking down the street and you see someone quickly walking behind you. He looks serious. He's looking at you and you think he's going to rob you. Immediately, your body, your actions, and your mood react to this thought. You start sweating, your heart races, you start to walk faster. You feel nervous and afraid. The person reaches you and quickly walks past you, getting farther away. You think that he is just in a hurry. So a good way to think about this therapy is that you will learn specific ways to change your thoughts and your actions so that you can feel better. The purpose of this therapy is to treat depression by teaching you different ways to better control how you feel. What do you think about these 4 goals? 1, to lessen or eliminate feelings of depression. 2, to shorten the time you feel depressed. 3, to learn ways to prevent or avoid getting depressed again. And 4, to feel more in control of your life.
Well, Danielle, I feel hopeful now that I was able to talk to you and learn more about my depression and that it is treatable. But in the beginning of the session, you talked about me having to complete personal projects. What types of projects do you mean?
Great. And I'm glad you asked about the homework assignments. Let's talk about the homework assignment that you will complete this week before our next session. This thermometer here lets us evaluate the intensity of depressive symptoms or mood at the end of each day. This exercise is called the mood thermometer, and you are going to complete it every week. We want to see how you feel each day and your mood changes throughout therapy. To complete it at the end of each day, mark how you felt or how your mood was in general for that day. For example, if it was the worst, then you should circle number 1. If it was regular, then you would circle number 5. And if it was the best, then you would circle number 10. Let's do one to practice using your mood yesterday. So bring it completed to next week's session so we can discuss it. Do you have any questions or comments about what we have discussed today?
No, I don't think so.
Okay, just so you're aware, next week we will talk more about thoughts that affect your mood, positive and negative thoughts, and how depressed people think.
My part of the group presentation is to cover the value and ethical dilemmas that might occur in the mental health field. Value dilemmas in mental health occur when the social worker's values and beliefs are different from the client's. An example is when the client wants to have an abortion, the social worker has strong religious beliefs against it, and those may not be in the best interest of the client. Another example of a value dilemma is becoming overly emotionally involved in a client case, which is failure to establish professional boundaries with clients. And when the social worker's personal values conflict with the values of the social work profession. The ethical dilemmas in mental health, most are centered around confidentiality and privacy, involving disclosure of confidential information to a third party, paternalism, which is a belief that it's justifiable to withhold information to clients for their own good, or you lie to a client for their own good, which is when you deliberately give false information in response to the client's questions because you feel that it's in their own good that they don't know, it's in their own interest, or physical interference with clients against their wishes for their own good. An example of that is forcing clients to receive medical treatment or reside in shelters against their wishes. In regard to confidentiality and privacy, disclosing information to parents of a minor is also a common ethical dilemma. The social worker needs to know the local and federal laws. Divided loyalties is another ethical dilemma in mental health. That's when there is a conflict between their client's interests and the interests of the agency in terms of their client's needs. The agency may have budgetary constraints, and the therapist may feel that the client really needs whatever services they're offering. Involuntary commitment is another ethical dilemma in mental health. That's when a client discloses an intent to harm himself or others, and you have a duty to warn, and that destroys the rapport between the therapist and the client. Commission of illegal acts is another ethical dilemma. The quote is that good clients sometimes do bad things. So an example of that would be a client who abuses drugs or is incarcerated, and the social worker has knowledge of that activity. Value and ethical dilemmas with CBT. The ethical dilemma that arises with CBT is that when the therapist is focused more on the practical and technical interventions of therapy and not on the therapeutic relationship. Another issue that arises with CBT is it's a very popular form of therapeutic intervention, and there are therapists who may believe that they have mastered it and they haven't. And there's also the failure to acknowledge cultural differences in beliefs and behaviors. So that leads to a lack of inclusion of cultural diversity as well with CBT. Diversity issues in mental health. The most significant diversity issue is failure on the part of the therapist to be able to recognize the cultural significance and importance of the client's behaviors and belief systems. And diversity issues in CBT. A recurring issue in the practice of CBT is the social worker's inability to practice with multicultural competence. Multicultural competence and cultural diversity are recurring themes throughout mental health. It's very important to take those factors into consideration. Okay, we looked at CBT and cultural diversity issues by looking at a study that examined CBT use and substance use among minorities and the treatment efficacy. So the issues that arose as a result of the studies were that they basically failed to include ethno-racial minorities. So therefore, you cannot measure the efficacy of CBT and substance abuse clients who were not of the dominant culture. So sociocultural barriers, that was another major issue, diversity issue with CBT, which is the inability to receive treatment from therapists who share the client's ethnic background and language. And the studies found that may have contributed to early treatment dropout among ethno-racial minorities.